Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracie Smith, and today I am here with Chief of Staff and Medical Specialist for the Incident Management Team, Dr. Zaki Ahmed. Zaki, thank you so much for joining me today. Now, as you know, obviously, our hospital has begun to ramp up the non-essential and elective services. Services will continue to increase very carefully and in an incremental manner from a 25% increase all the way up to over 100%. Now, addressing the backlog could mean offering services 7 days a week, different hours of the day than we're used to. Are physicians on board with this decision?
Yes, Tracie, thank you. Thank you for having me. So physicians are quite on board. It's actually their idea in terms of trying to see how we could make sure that we not only, as you said, do what we have missed and start doing stuff up, but also catch up on all that for 3-4 months by the time we get started and get rolling. Of backlog. So we know that patients have been calling physicians' offices looking for times for their surgeries. There have been patients who are at home waiting for procedures for well over a year because they were supposed to get it done in March. Now it's prolonged. So we want to make sure that from a physician standpoint that we get those patients in as quickly as possible.
How long do you think it will take to get caught up?
That's a very tough question. So we were operating at maximum capacity before all this had hit, and we were still having a lot of people wait for their procedures. As we have now the backlog plus the people that were waiting, we expect that we would be struggling in order to try to catch up.
Okay, so we talked a little bit about the fact that we might be looking at extended hours of operation in order to catch up. How do physicians plan for that?
So the way they would work is we would have people that would be on call. So there would be people who would be operating on one day and then take a rest break and things like that they have to take in order for the health of them and their patients. So there would be times where we would extend into periods where we don't usually operate. So the weekends, for example, Saturday and Sunday, do those surgeries, some of the surgeries on Saturdays and Sundays, so that you could spread the people apart. So physical distancing, there's two important concepts. So there's a physical distancing, so where you have to keep the patients and their families and their visitors separate from each other. But there's also a thing called temporal distancing. But because of the fact that now with COVID, there has to be term cleans and things like that we have to completely turn around the room. So there's what's called temporal distancing, where you have to spread the people apart in terms of time. And that's the part that we would try to do with weekends and over past the regular working hours or regular business hours, as I call them. And physicians are on board with trying to do that.
Well, that's fantastic, and thank goodness we have such dedicated physicians here. Mm-hmm. What is the physician's role in terms of prioritizing and rescheduling the patients who have been waiting?
Yeah, so no one knows the patients after the patients, obviously, but in the organization, no one knows the patients better than their own physicians. So we've really left it to the physicians to let us know who are the priorities in their patient lists. And once those priorities come in, doesn't mean that they can get all their patients in, but there's a clinical ethical triage committee that sits, takes a look at all the patients that are waiting for surgeries that have been identified by their physicians to have the surgeries done. We then take a look at all of them and try to go through there's a checklist looking at 121 points of whether the patient's surgery, if it was delayed by more than 4 to 6 weeks, would it be detrimental to the patient, or would there be more surgical complications? Then we also have to take a look at our PPE supply or medication supply. So one of the things that's in huge shortage right across the world right now is sedating agents, paralyzing agents that we need to do some of the surgeries. We also have to take a look at the amount of COVID in the region, amount of COVID in the hospital, amount of COVID in the ICU, and what is the likelihood of that patient needing those services afterwards. Based on those, the clinical triage team takes a look at the whole board and sees which are the patients that should be operated on earlier than later.
How long is this team getting together to review lists?
So they started doing this 2 weeks ago. They've been formulating the plan in terms of how you're going to do this very objectively. So obviously, if I know Mr. Smith, I want to make sure that Mr. Smith isn't the first one that's on the board. It should be done in a very transparent. So we want to make sure that we're fair in our process. It's equitable, so everyone is on the same playing field, and that we're transparent about how we're triaging people to come first or second.
Okay, so a lot of the physicians, and particularly specialists like surgeons, provide care at our hospital and also have private clinics. So with this increased demand at the hospital to catch up with all of those services, how are those physicians going to be able to balance their work here and the need to do that follow-up work in private clinics?
Yeah, so that's a great question, and not only just in their own clinics, but also rehab facilities, right? So in terms of how are you going to adjust those? So those are all the things that the business recovery plan is taking a look at. Obviously, you need to make sure that the patient's seen in the preoperative time, so before the surgery is done, during the surgery, and then after the surgery. And the surgeons have been fantastic with giving extra time to the patients to try to catch up with that. So they're going to be it's hard to believe that people can work past the 8-hour days, but actually 8 hours doesn't exist in a surgeon's life. So it's usually a 10, 12, 14-hour day. So.
Or more.
Or more.
Absolutely. Yeah. The amount of dedication is phenomenal. Okay, so finally, now traditionally we're moving into the summer months. Traditionally, our hospital relies even more on locum physicians who are physicians who live or work elsewhere and come to Thunder Bay to provide service here at our hospital. So how does the current situation and the COVID-19 pandemic impact our dependence on locum physicians?
Yeah, I think if anything, it's gotten less dependent on the locum physicians, simply because a lot of the physicians here have just, as I said, done a lot more than working 2 weeks in a row, 3 weeks in a row. Some of the COVID physicians have been working since April without a day off, right? So physicians have done fantastic work to try to prevent locums from coming in just because of the spread of COVID. However, now we're going to get to a point where if we continue to work the same physicians the way they have been working, it's going to be burnout. It's going to have detrimental effects on not only their health, but their patients' health, because they're not healthy. So it's really important to make sure that we allow for safe transition so that people can come in from out of town. We test them appropriately so that we know that they're safe, and continue to work that way.
Fantastic. Well, I want to say kudos to all of the physicians that work within our hospital and in our community, because it's been a very well coordinated and dedicated effort that's been getting us through this.
Well, it's not just physicians, right? So it's physicians are only one part of your healthcare. It's all the people that are involved. So starting from administrators, to the nurses, to the physiotherapists, to the physician assistants, the nurse practitioners, everyone who's involved in the care has been stepping up tremendously.
Quite true. Excellent. Thank you so much, Dr. Ahmed. We'll see you again soon.